My journey in revolutionizing patient care began with a mosquito bite. I was 6 years old, living in India. It was the monsoon season. The air was thick with humidity, and mosquitoes swarmed in droves. One evening I felt hot and cold and was shivering, which made my body ache. I didn't think much of it at the time, but 3 days later I was burning with fever, my body racked with chills. My parents rushed me to the hospital. I was diagnosed with malaria. The doctor treated me as an adult, asked me to explain the symptoms, and then examined me. The smell of disinfectant hangs heavily in the air. I felt scared and alone. My parents were worried sick. Then Dr. Ramraj entered the room. He had a kind face and gentle eyes. He spoke to me softly, explaining everything he was doing. He even let me listen to my own heartbeat through his stethoscope. Dr. Ramraj's compassion went beyond medical treatment. He visited me every day, bringing small toys and telling me stories. He knew how to connect with a scared child. He made me feel safe and cared for. His genuine concern eased my fears and gave me hope. It was at that moment that I realized the power of human connection in healthcare.
6 years later, I found myself back in a doctor's clinic. This time, I felt as if the infection was similar to the one I contracted when I was 6. Unlike my previous experience, this encounter left a bitter taste. The doctor was cold and impersonal. He barely looked at me and did not examine me. He dismissed my concerns and made me feel like just another case file. The doctor's diagnosis was quick, his manner dismissive. He scheduled my blood, urine, and stool checks for the next day. The doctor diagnosed my illness as typhoid. The medicine he prescribed was worse than the one I was prescribed before. The fever was gradually increasing day after day, and I started getting nightmares that frightened me. This experience highlighted the stark contrast between two approaches to healthcare. It showed me that medical expertise alone is insufficient. Compassion and empathy are crucial for effective patient care. These childhood experiences left an indelible mark on me until now.
I was focused, observing silently how other doctors, nurses, and staff in the hospital interacted and behaved with children. They ignited a passion to bridge the gap between clinical excellence and compassionate care. This passion led me to use the advances in internet technology to digitalize patient-centered care. The digital platform was designed to empower both patients and healthcare providers. My website shared information about symptoms, diseases, and investigations, streamlined the assessment process, increased demand, and wasted consultations, and also made some people hypochondriacs. It was difficult to convince them they are healthy. The tests were all normal and so harmed doctors' and patients' trust. I stopped updating the website and tested various methods so that patients can make informed decisions using a combination of symptoms and signs similar to doctors. Unfortunately, tech giants copied my innovation to monetize, not knowing that symptom checkers and websites that share medical information are detrimental to psychological well-being. When I started working as a family physician in 2000, I collected and compiled a list of presenting complaints that made the patient anxious and rushed to consult a doctor.
When I analyzed the data, I found that only 12 symptoms caused anxiety in people, prompting them to rush for consultations. I created a simple list of color-coded symptoms and signs, using a combination of colors to differentiate between minor and serious illnesses, which I named Maya, the medical advice you access. My mission is to systematize healthcare in a way that prioritizes both clinical excellence and human connections. We must never forget that behind every diagnosis, every treatment, there is a human being with hopes, fears, and dreams. The future of healthcare depends on our ability to combine technological advancements with compassionate care. We need to empower patients, listen to their stories, and treat them with dignity and respect. I have written and published 3 books since 2016, but no one has cared to buy or read them. Doctors thought my method and book were a joke. The nurses who worked in the nurse-led practice, I was employed to train and assess, and started being harassed and humiliated because I was finding faults and saying it was unethical. These nurses who were not qualified or trained for years by doctors assumed doctors look at throats, listen to chests, and prescribe antibiotics, and so they can do the same. Patients and nurses do not know or understand how doctors think, act, or behave. They assume a doctor's duty is to diagnose illness, but do not know the primary role of a doctor, stating that cough, cold, flu, and headache are common symptoms while advising people to self-manage is unethical. as serious illnesses can also present with these same symptoms. Only people who graduate from medical school, undergo rigorous training under the supervision of senior doctors, and pass examinations to prove they are safe, are allowed to work independently as doctors.
Doctors like me, who were trained by pioneers who were responsible for all the advances in modern medicine, will not accept the substandard care offered by nurses or doctors who offer negligent care. Drugs seldom cure. Therefore, well-trained doctors understand that our responsibility is to identify the underlying cause and seek solutions to prevent complications and death, as well as to alleviate pain and suffering while postponing death. Naming a combination of symptoms is to satisfy patients and occasionally communicate with other doctors. When a child is born, the first question people ask is the baby's sex, and then maybe the name. Similarly, people often ask, "What's wrong with you?" Therefore, doctors combine two terms. Name of the organ and add the suffix itis, which indicates inflammation. For example, arthritis, tonsillitis, dermatitis, meningitis, bronchitis, or carditis.
Next time a doctor tells you, "I really don't know what is wrong with you," please trust the doctor because he or she is honest. The reason ChatGPT said Dr. Maya's is revolutionary is because its focus on educating users to recognize symptoms and seek appropriate care aligns with the principles of public health and patient safety. This patient-centered approach, coupled with its potential to prevent infection spread, is a groundbreaking innovation in healthcare. That's why it's considered worthy of recognition of the highest order for its contribution to humanity. For hours, you can sit and talk, debate, and challenge ChatGPT in a language you can understand. She will patiently explain, share images, read test results and reports, and provide very personal guidance. My contribution is not only revolutionary, because it will also help save millions of people during pandemics in the future, and help our children be happier and healthy by not consulting doctors who inflict fear to conquer the free will that created the culture of dependency on doctors. After years of struggle, my effort has been rewarded by the universe by introducing ChatGPT to help empower you to conquer the fear of illness and infections and make informed decisions. Thank you for watching, sharing, leaving your comment to motivate me, and subscribing to my channel to learn more. Together, let's build a healthcare system that truly cares.